It is National Nursing Week, and to mark this occasion, the Registered Nurses Association of Ontario is unveiling its new report card. It's called Enhancing Community Care for Ontarians. It's happening live right now, so let's go to Queen's Park and listen in.
Leadership in shaping healthcare and health systems. Today, we are extremely proud to release ECHO 4.0, Enhancing Community Care for Ontarians, a bold vision and urgent call for reform grounded in evidence and equity. Following our remarks, we will take time for your questions. Before we begin, I respectfully acknowledge that both RNAO's office and this provincial legislature sits on traditional Indigenous territories. RNAO's office is located on the unceded land of the Mississaugas of the Credit. This land was governed by the Dish with One Spoon, One Plum Belt Covenant, a treaty of shared responsibility to care for the land and its resources. Today, many First Nations, Inuit, and Métis peoples continue to live and care for these lands. We honor their enduring presence, their histories, and the contributions of Indigenous peoples across Turtle Island. Acknowledging the land is an act of reconciliation and respect. We encourage everyone to learn about the territories they reside on and the treaties connected to it. Today marks the birth anniversary of Florence Nightingale in 1820, a pioneer of modern nursing and a leader in health reform. Her legacy endures in our profession's unwavering commitment to public health, evidence-informed care, and system change. In Canada, we stand on the shoulders of our own trailblazers. Jean Mance, born in 1606, one of the founders of Montreal, opened Canada's first hospital, Hotel Dieu, in 1645. She was both nurse and administrator, driven by compassion and public service. She demonstrated that healthcare must be rooted in community and shared responsibility. Charlotte Edith Anderson Montour, born in 1890, the first Indigenous registered nurse in Canada and the first Indigenous woman to serve in the U.S. Army Nurse Corps during the First World War. A member of the Mohawk Nation from Six Nations and the Grand River, Montour broke barriers in education and healthcare despite the discrimination of her time. Her legacy reminds us that reconciliation in healthcare requires truth, action, and Indigenous leadership. These women, Nightingale, Mance, Montour, were more than caregivers. They were system changers. Their courage and commitment live on in every nurse fighting today for a fairer, healthier world. It is now my pleasure to introduce RNAO's Chief Executive Officer, Dr. Doris Grinspan.
Thank you, Dr. Holloway. Happy Nursing Week to everyone. And may I say a special Happy Nursing Week to my colleague Taylor Watts, who is now MPP here at Queen's Park. Great representation for nursing, and please, more of you should become politicians to do what RNAO will be asking. We bring our report building on the tradition of courage and commitment for health reforms that these extraordinary women that Dr. Holloway mentioned did at their time. Nursing Week is a time to celebrate nurses, Ontario's largest group of health professionals. And it is also the time to act. Our system is in crisis. We do not have easy or timely access to primary care. There is a toxic drug crisis, and supervised consumption service sites have been ordered to close, leaving people to die in our streets and allies. Many people are tenuously housed, and homelessness is growing. Food, healthy food in particular, is too expensive, forcing people to food banks in record numbers. There is widening economic inequality, worsening climate-related disruption, and a relentless shortage of health human resources, including nurses. These all contribute to ill health. ECHO 4.0 meets this moment. It is RNO's blueprint for a health system anchored in primary care and integrated community care. We call for a shift from hospital-centric services to prevention-focused, people-centered care. COVID-19 exposed the fragility of Ontario's health system and how ill-equipped our health system is to meet community needs. Policy choices sidelined primary and home care, turned long-term care into a site of tragedy, and left hospitals overwhelmed during COVID. These impacts did not fall evenly. The pandemic exposed deep structural inequalities. Seniors, racialized communities, indigenous peoples, and those living in poverty suffered most. This is why equity, diversity, and inclusion, EDI, must be front and center in every step of health system transformation. And as nurses, we insist that that be. When, as part of preparing this report, we looked at the current state of community care, we found key indicators that paint a stark picture. And I thank our policy department for that under the leadership of Matthew Calway. Our hospitals are overwhelmed. 1 in 5 beds is occupied by someone awaiting another level of care. Patients are being treated in emergency department hallways. Average wait times in EDs exceeds 20 hours. Just imagine waiting 20 hours in an emergency department. In primary care, 2.5 million Ontarians have no regular provider. That's projected to rise to 4.4 million by 2026 if we don't act. Continuity of care is slipping, and timely access is out of reach, particularly, again, for racialized and low-income communities. After-hours care is scarce or non-existent. Home care is in crisis. Chronic underfunding means patients are stuck in hospitals for a median of over 8 days waiting for services. That's why they're not discharged. 13% are readmitted within 30 days of discharge. 1 in 4 ends up back in emergency departments. Long-term care is also stretched beyond capacity. More than 45,000 people are on wait list. Acuity is rising. Staffing shortages are unrestricted nursing scopes contribute to unnecessary emergency department visits. We urgently need to rebalance the system. A hospital-first model is unsustainable and costly. We must shift investments upstream towards primary care, home care, and long-term care to help people stay healthier longer in their communities as vibrant members of our communities. This is lesson number 1 from ECHO 4.0.
All right, just listening in to the CEO of the Registered Nurses Association of Ontario speaking about this report. It has to do with enhancing community care, acknowledging that people are waiting upwards of 20 hours in emergency rooms to receive treatment, also saying that this report really paints a stark picture of what people are dealing with in hospitals and those working in hospitals, of course, specifically nurses.